Hello, everyone. Welcome to episode 3 of Conversations for the Common Good. I am Tyler Whipkey. I direct mission and spiritual care at St. Luke's Hospital in the Woodlands. And I am joined today by Raquel Webb. Raquel, introduce yourself to the fine viewers at home.
Hey everyone, I'm Raquel Webb. I'm manager of spiritual care for our St. Joseph Market and Bryan College Station and some of the other counties here in the rural areas in Texas.
Fantastic. So today we are going to be talking about well-being. Now, Raquel, when I hear and I think about the term well-being, I'm assuming that that has to do with practices and mindsets and things that we can do to help us just to be well. Am I on the right track on my train of thought?
You are. That is exactly it. We're living through this COVID crisis. And I think if we were to take a survey of the people watching today and asked, how are you doing through this? I suspect many of you would answer that you're not doing well. That's why we're talking about well-being. Another answer I often get is, I'm surviving. What I want to focus on today is that instead of just having all of us survive through and barely make it out alive through this crisis, what if we were still able to live well, to flourish, even to thrive? And I also want to clarify the term well-being and the difference between well-being and wellness. When you hear wellness, that's typically our physical health. Wellness is about having a healthy body, a healthy mind. We wear a step tracker, we exercise, we try to eat right. That's wellness. On the other hand, well-being is used for our psychological, our social, our spiritual health. Well-being has to do with whether we are trudging through and surviving, just making it, or whether we're living well and we're flourishing.
So you use the word flourishing, and I know that that's certainly what I want for myself. I want to be able to say that I am flourishing and doing extraordinarily well, and I would imagine that the folks who are listening in on our conversation today, they would probably say the same thing. They want to be doing as well as they possibly can be. So how can we get there?
Right, so one of the things is you can really be overwhelmed by the amount of materials that you find on the internet with well-being. So I want to introduce you to just one, and that's one that's really helped me personally in my life. Matt Bloom is a professor who studies well-being at Notre Dame. And so I'm going to follow his model. But scientists know that we flourish when we focus our lives on these 4 areas. And I'm going to ask you, Tyler, to share your screen. The 4 areas of our lives to pay attention to in order for us to flourish are these daily well-being, resilience, authenticity, and thriving. So that first one there, daily well-being, has to do with the quality of our daily lives every single day. And I'm going to come back to that one in a minute. Resilience is really our capacity to adapt, to change. Here we are in COVID. Resilience is how we're able to respond to those challenges, okay? Authenticity has to do with our identity. Our sense of self-integrity and dignity. Often when people are not being authentic, that's when they're just surviving. They aren't flourishing. And then thriving. Thriving is a sense of meaning and purpose in life and work. So our sense of having values and beliefs that inspire us, that create purpose for us, provide a moral guidance to our lives. Things like experiencing deep and positive connections with others, that's called thriving. So I like to call these 4 the building blocks of well-being, or the 4 dimensions of well-being. And if you go ahead and go to the next slide, this is illustrated in a little bit different way, but I really like this because it shows that these 4 building blocks, they really build upon each other and they work together. When one area goes up, it boosts all the others. When one goes down, it drags all the other ones down as well. So we need well-being across all 4 of these dimensions in order to flourish, to not sink, not just survive. Let's flourish. You also see very lightly around all of this in this bubble is that word that says social ecosystem. So it's important to remember that our health and our well-being are impacted by the people and the groups that we live and work with. We call that a well-being ecosystem, and we all live in them. So our well-being is shaped by the vitality of our own families, our departments at work, our organization, our coworkers, our neighbors, even our friends. That's our ecosystem. And because we don't have a lot of time today, I want to just pick one of those 4 and focus on one building block. And that one that I want to talk about has to do with daily well-being, which is the first one. Here in this slide, it's referred to as happiness. And that's because the way we usually measure daily well-being is through examining our own feelings about the day that we had. Feelings have a lot to do with happiness, right? So that's why some people call daily well-being a happiness measure. Do we think our lives are going well and moving in the right direction? Or do we think our lives are dominated by pain and struggle and suffering? How we feel inside about it matters. How we feel about how our day is going also matters. And so I want to suggest to you that a way to improve our daily well-being is to begin to track how we feel. So if you go to the next slide, we can use these feelings here, and you see some positive emotions and some negative emotions that are very common. And let's say that you were to circle which emotions, which feelings you experienced in any particular day. If you mostly circled negative feelings, then you probably had a bad day. If you circled mostly positive feelings, then you likely had a pretty good day. And the basic idea from science is that our daily well-being is higher when we circled the positive feelings, when we're experiencing those good positive feelings, than if we had negative feelings.
So that sounds interesting. So that sounds like something that I could do fairly easily for the next week. I could just take a few pieces of paper and track my day and just list how I'm feeling and the positive and the negative emotions. And Raquel, what it sounds like I'm hearing you say is that if I have more good days than bad days, then my well-being, I could rank that or rate that as being higher or high.
Exactly. How often you rate your day as a good day does matter. And research shows that daily well-being accumulates over time. So here's just a quick illustration. Tyler, I'm going to ask you, can you remember what you had for lunch yesterday?
Let's see, for lunch yesterday, I had a a lean cuisine pizza and it was delicious.
Okay, so thanks for sharing. And but that's just to illustrate that most of us would remember a detail from our day yesterday. Now, Tyler, can you remember what you had for lunch last week, or let's just even say any given day last month?
Uh, on a specific day, no, I cannot remember that.
And there it is, none of us can. And the point is the flow of our daily lives tends to fade into memory in the same way. We don't really remember the details of every day of our lives, but nonetheless, they add up. Good days and bad days, they add up over time and they affect our health. So if we have too many bad days, it starts to affect our capacity to be at our best at work. Our ability to adapt, our ability to change. Bad days bring all of those abilities down. So let's get more specific, right? Because work in healthcare is very difficult and challenging, especially now. And I want to take the example of maybe a nurse who might be listening in. Nurses are often face to face with human suffering. Their days are long. They're full of the unhappy experiences of others, maybe their patients, and they're focusing on caring for another person, not themselves. So nurses, I would say, might be people who experience a lot of bad days. Science shows us that these negative experiences are really starting to pile up on us. So friends who are watching, I want to say to you, start to pay attention, excuse me, to how your days are piling up. Is your pile of unhappy days getting larger? Do you feel like, here we are at almost the end of August, and where did July go? It's rushing by. If so, I want you to take a step back and pay attention to your everyday experience. Our goal in well-being is to have those activities, those relationships that will give us the positive feeling experiences in our lives. We need more of the good days. Ignoring the bad days will not work, so we need a better approach.
So Raquel, let's say that I start noticing that I'm having too many bad days, that the bad days are significantly outnumbering the good days, and my well-being is really suffering because of that. What are some things that we could do? What's a good starting point for this?
So boosting our daily well-being can be done. It's not impossible. And it's not necessary for us to change our whole lives, our whole ways of being. Let's face it, we can't do that at this point. We need to find a quick way to make this work. There's no giant leap. Just take small steps, simple practices that often might just take little minutes. Those, again, just like our bad days and good days, they accumulate. So they add up to make a difference for us over a long range of time. Small steps is achievable. So it's realistic for us to believe that we can do small steps over time rather than just changing our whole lives. The point of taking small steps is that we want to mitigate those bad days. So here's a small step. And it happens to be my favorite one because it's easy. And that is a small step of finding something that will help to quiet your mind, to calm your body, and focus your attention on something positive. Again, I've been focusing a lot on positive and negative feelings. And if you're interested, this is a part of the school of positive psychology. It's real and it works. We talked a little bit about this in episode 2. But this could be 5 minutes of meditation. It could be 5 minutes of concentration. If you're a person of faith, it can be a quiet moment of reading holy writings or a prayer. It can simply be sitting in silence and thinking positive thoughts. That's a small step. Here's another idea for a small step. Have a notebook or a journal by your desk. And we spend, a lot of time at work. So that's why I'm suggesting keep this at work. Maybe half of our waking hours are at work. And if you think about your daily experience, research shows that our negative experiences and emotions take up a lot more time in our hearts and in our minds than positive experiences do. We're living through the challenge. Our lives are powerful. So taking time to focus on the positive experiences surrounding our day will be crucial for our well-being. So every day, take that piece of paper or that notebook. Can you write down on this journal 3 positive things that happened in your day? If it was a bad day, can you find at least 1 positive emotion you experienced despite the bad? Can you do this every day for a week? Track the positive feelings related to your work and what this small step will do, that with time, it will improve your work experience. It's a small step.
Fantastic. That does sound like a very manageable and practical recommendations. So I know that I'll be giving that a shot as I move through my week. Raquel, thank you so much for taking time to share your wisdom and your expertise. And before we go, I just want to remind folks again that your chaplains are willing and more than able to help you have these conversations, because I don't know about you, but every once in a while I struggle to name and identify my feelings. And I just need somebody to bounce that off of, to finally get the right vocabulary down to make sense of what's going on. And so please don't hesitate to reach out to your chaplains in your local hospitals. We are here for you. We are here to support you. So folks, that's all for us today. Thank you so much. And we will be back next week and hope to see you then.
Thanks, friends. Be well.
Bye-bye.